Hello, my name's Caroline. I'm a diabetes specialist nurse working for West Hampshire Community Diabetes Service. This video will explain how to check for ketones and when you should check for ketones. You may want to look at video 2, What is diabetes?, to learn more about how a lack of insulin can cause the body to produce ketones, because the body cannot use glucose, which is the usual source of energy. Without insulin, the body begins to use body fat for energy, producing ketones that can be detected in blood and urine. This can lead to diabetic ketoacidosis, or in other words, DKA. Signs of DKA are ketones in the blood and urine, abdominal pain, nausea, vomiting, and eventually unconsciousness. If left untreated, DKA can potentially be a fatal illness. Everyone can produce ketones if they have not eaten or are unwell, but these do not usually rise to dangerous levels. Ketones can be measured in the urine or blood, so it is important that you always have some ketone checking strips available to check for ketones when you are unwell or when your glucose levels rise. It is advisable to check the expiry date on your urine or blood glucose strips before use. So when do you check for ketones? When you're unwell, when your glucose levels rise above 15 millimoles per litre, when you're unwell and if you're on an SGLT2 tablet, for example dapagliflozin, or when glucose levels are raised and you're planning exercise. Urine ketone checking is done by you passing urine onto one of the urine strips and reading the colour change after 15 seconds, or as instructed on the pot. A reading over 1+ needs action. There are a number of glucose meters which also check for ketones, but not all meters check for both glucose and ketones. Each ketone meter will have guidance instructions on ketone levels, indicating whether the reading is green, amber or red. Green. Levels up to 0.6 millimoles per litre are considered acceptable for most people with diabetes, but consider rechecking blood ketone levels in 1 to 2 hours if your blood glucose levels remain high. Amber. 0.6 to 1.5 millimoles per litre indicates a need to take extra insulin and consider using a correction dose and rechecking your blood ketones and glucose levels in 1 to 2 hours. You may want to call your healthcare professional for medical advice. Red, above 1.5 millimoles per litre, indicates a risk of ketoacidosis. You should call your doctor immediately. When you have ketones above 0.6, you are more resistant to your insulin, and so you may need a higher correction dose to bring your glucose levels down. We explain more about managing illness in one of our other videos. Some people who have type 1 diabetes are taking a tablet called an SGLT2. Dapagliflozin is the usual one prescribed for people with type 1 diabetes. This tablet works in your kidneys and helps you excrete more glucose. If you are unwell and taking this tablet, you may be at high risk of developing DKA at lower glucose levels, so it is important that you can check for ketones. Because of this increased risk of DKA with SGLT2 tablets, if you are unwell, it is recommended that you stop taking this tablet during your illness and contact your GP. Thank you for watching. This video is part of our Type 1 Structured Education course. For individual advice, please speak to your healthcare team.